there's coaching and counseling, so you're not just having the foods of this program for the rest of your life, but you have some of this and you have healthy choice decisions. And I think the difference, I've tried the Nutrisystems before, where you get prepackaged meals that didn't taste good and such, or you sit in an office with a bunch of other people and they're yelling out your weights and stuff, and that can be embarrassing, or the Weight Watchers and it's counting points but you're not sure what's what. This kind of eliminates all that. I'm Jeff Gibson, and I've lost 102 pounds on Dr. Tack's weight loss program. So January 28th of 2021, I saw my normal physician and I weighed the heaviest that I have ever weighed. She also put me on some medication for elevated A1C, and I decided that was the day I needed to do something. So it took about 2 weeks to find a weight loss physician, as well as set up an appointment and get it on the schedule. And that was day one of this journey to lose weight on his weight loss program. On the Level 5 program, you meet with Dr. Tack every week. You get a weigh-in, which also scans your body for fat content, water content, muscle content, all this. And the weight loss program involves meal replacement. There's shakes, there's soups, there's sloppy joes, there's bars, healthy bars. The overall idea is to lower the caloric intake from what you're normally eating, and with that you reduce the weight. It's not really a diet program, it's a healthier eating program that kind of changes how you think. It's a different mental outlook afterwards. As I progressed through the program, I had some huge weight loss weeks. Every Sunday I would come in and meet with the doctor, do my weigh-ins, and there's a fancy body impedance or whatever for his system, body composition analyzer. I'd have big weight loss numbers, 15 pounds a couple times, but it wouldn't be crazy to be a 10 to 12 pound for a week. And that it's like, this works, and it just emphasizes more. And then clothes are real loose and you got to go buy new clothes, and it's like, I bought some new clothes and I'm not going back to the other stuff. I'm getting rid of that. Dr. Tack did reevaluate the blood work, so we redid the blood work. Better numbers, A1C issue was corrected. We had a vitamin D supplement to fix that, corrected. Testosterone increased just from the weight loss. I do have sleep apnea, had it since, diagnosed in the end of 1998. So I've been on a CPAP for well over 20 plus years. And my pressure was up to 16. Now I don't know if that's considered PSI, but 16 was the pressure on my CPAP machine. As of, today, I am down to 8.2 for my pressure. So I've cut what I needed in half. The dentist, I went to the dentist, there's less plaque in your teeth and stuff. The cleaning was easier at the dentist, so, which surprised me. But you're not eating all those sugary, bad foods and unhealthy eating. It's been great. I have more energy, libido's improved. I have 2 fake hips, so the weight loss is better for the fake hips. I move around better, I'm sleeping, I feel healthier, I don't need naps during the day. Overall health has just improved, and I'm so happy I did this. And I'm still on my journey. I still have more. We have another temporary goal. I think I'm about 13 pounds from losing that. And the plan is, when we hit that, I'm going to reevaluate of where I want to be next. So I'm sure there'll be more weight loss in the future with this program. I think Dr. Tack's a great communicator. He is looking out for my best interest. I know when we meet weekly, he is always, how are you feeling? Do you have more energy? And sometimes on my end, it's kind of like, we ask this every week and it's improving, but this is what he does, and he documents it. How are you doing? How are you this? Have you struggled with anything? Do you need help? What do you, and he gets into, what are you eating? Well, I eat this. How come you're not eating this? Well, I don't like the flavor. Have you tried adding some berries to that flavor? That gives you a little variety. And just, he's very involved in what you do. And again, back to a comment I had before, when I call here and need to talk to him about something, if you get the answering service or he's with a patient, the nurse say, he'll call you back. And he does, within about 5 minutes. Or as soon as he's done with the patient, you're receiving a phone call from the doctor. You're not waiting till tomorrow or the next day to hear something back. So he's very involved in your patient care. He's always sharing ideas. Doesn't mean you have to take what he says, because he's your physician, but you have rights. But he's not short on ideas and suggestions, and I truly feel he does look at my health for the best interest of my health.